What we're going to be doing now is looking at the pelvis. And we're going to begin with looking at the sacrum, then move to the individual hip bone, talk about the pelvic girdle, and then get into the different muscles that you need to know in the pelvis. First, let's start with, as I said, the sacrum. So we know the sacrum is 5 fused sacral vertebrae coming together. Superiorly, the sacrum will articulate with the lumbar vertebrae. Inferiorly, the sacrum will articulate with the coccyx. Laterally, at the auricular surface of the sacrum, you're going to have that articulate with the auricular surface of the hip bone. And when these two surfaces come together, this is the articulating surface or the auricular surface. When you put these together, you create the sacroiliac joint, synovial. Okay? So the articular surfaces come together to create the sacroiliac joint. Note the concavity of the sacrum itself and how there's something that is going to be running on its anterior surface beginning at S3. That's the rectum. So the rectum essentially begins at S3 and continues down before it comes into the anal canal and then the sphincter, the anal sphincter. If we move from the sacrum to the hip bone, let me zoom out just a little bit. We're going to look at the different features of the hip bone now. So the hip bone is actually divided up into 3 different sections. The entire top part is known as the ilium. The lower anterior section is known as the pubis, or the pubic bone. And the lower posterior surface is known as the ischial bone. So you have the ilium, or the iliac bone, the pubis, or the pubic bone, or the ischium, or the ischial bone. Okay? First, let's talk about the ilium. So the ilium has 2 different surfaces. It has its medial and lateral surfaces, which we call actually the gluteal surface on the outside. And then you have the iliac fossa on the inside. Along the top ridge of the iliac fossa, underneath the iliac crest, which is all along here, so this being the iliac crest, on the front of the iliac crest, or at the top of the iliac fossa, is where you have the iliacus muscle attached to. Before it comes down, fuses with the fibers of psoas major, and inserts into the femur. Going back to the gluteal surface, what we see below the gluteal surface is the acetabulum. The acetabulum is what allows for the head of the femur to insert in here and allow for the joint with the femur to actually happen at this point. This is one of the diagnostic tools for telling the lateral surface versus the medial surface. And the acetabulum will help you determine whether or not you're looking at a left or right hip bone. There are some other features I'm going to help orient yourself with to help you tell whether you're looking at a left or a right hip bone. So if we go from our, as I said, gluteal surface over to our iliac fossa, okay, we see a couple more features on the iliac bone. Anteriorly, we see the superior and inferior iliac spines. Superior, inferior iliac spines. Posteriorly, we also have some iliac spines. We have the superior and inferior iliac spines posteriorly. And running from the anterior superior iliac spine all the way to the posterior superior iliac spine is where you have your iliac crest. You'll remember the iliac crest because quadratus lumborum inserts into the iliac crest. Then the only other features other than, so we have anterior superior spine, anterior inferior spine, posterior superior spine, posterior inferior spine, articulating surface or auricular surface. Then underneath it we have the greater sciatic notch. And the greater sciatic notch ends up becoming a foramen because of the ligaments that get made in the pelvic girdle. So those are the features of the ilium. Now let's look at the pubic bone, or the pubis. The pubic bone, or the pubis, on its medial surface will have the symphysial surface. And the symphysial surface will end up meeting with the symphysial surface of its partner hip bone to create the symphysis pubis. And that's what's created here. So you have the symphysial surface of the left coming together with the symphysial surface of the right, and that's what creates the symphysis pubis. And an interesting diagnostic tip for you, for all aspiring medical students, is that the angle made here at the pelvic triangle or urogenital triangle will tell you whether or not you're looking at a female or a male pelvis. If the angle made here is greater than 90 degrees, then you're looking at a female pelvis. If it's narrower or acute to 90, then it is a male pelvis. So going back to the individual hip bone, and I just told you about the symphysial surface. This is one of the other diagnostic tools for telling whether or not you're looking at a left or right hip bone. So you automatically orient yourself with the acetabulum. You place that laterally, and then you find your symphysial surface. And your symphysial surface in this instance is anterior here, pointing medially. So now you know you're looking at a left hip bone. So going back to the pubis bone, we have, as I said, the symphysial surface making the symphysis pubis. We have the superior ramus of the pubic bone and the inferior ramus of the pubic bone. The inferior ramus of the pubic bone will end up forming what is called the ischiopubic ramus with the ischium. So this part here would be part of the inferior ramus of the pubic bone, but the entire thing is known as the ischiopubic ramus. And what happens is gets this enclosure which we call the obturator foramen, for which we'll see a muscle, fascia, and some membrane that covers that. Moving posteriorly, we see the ischium. And the major things to note in the ischium are the ischial spine, the lesser sciatic notch, lesser sciatic notch, and the ischial tuberosity, which is when you sit on your butt, what you're sitting on, when you feel your bony butt. That's the ischial tuberosity. And those are the features that make up the individual hip bone.